Welcome back to MedFluencers Unscripted. My name is Dr. Adam Goodcoff. Excited about our guest today, Dr. Vadada, who is our first ophthalmologist on the podcast. We just finished an incredible conversation with her. We definitely we got the scoop for you guys for everything from eye floaters to blindness. So you'll find some level of interest in there. If not, you'll grow your eyelash length by the end, as I have figured out from some Googling. So very interesting episode. We'll see you in there.
Thank you for having me.
It's our pleasure. We haven't had an ophthalmologist yet. Ophthalmology, first of all, I won't make you spell it and put you on the spot, but I challenge anyone listening, go spell ophthalmology correctly.
It's different than what you would think.
It's a tricky one.
Yeah.
But what does an ophthalmologist do? What is different about an ophthalmologist to an optometrist? Let's start there.
Yes.
Sure. So, ophthalmologists and optometrists work hand in hand, but an ophthalmologist has gone to medical school. I would say the biggest difference is that ophthalmologists do more medical and surgical disease of the eye, whereas optometrists are more focused on glasses and contact lenses and also just general screenings as well.
So Dr. Vadada, what are you seeing kind of day in and day out with your patients? Like, what are they coming to you for?
Yeah, so a lot of my patients are surgical in nature. So I'm seeing a lot of cataracts. I'm cornea trained, so I also see corneal issues, so corneal transplant patients, a lot of dry eyes, and then there's kind of the bread and butter, I guess, if you will, of ophthalmology. So, the diabetics for screenings, the glaucoma patients or glaucoma suspects, just, kind of eye wellness exams.
I have some niche questions that I think will be kind of funny to the right audience. Are you a tonopen person, or are you like the rapidly oscillating eye dot thing?
So I would say I'm a tonopen person, I guess. So there's an applanation. There's an applanator on the slit lamp.
Right.
Yes. So, I guess I would say I'm an applanator, maybe.
Right.
That would be more accurate. And the tonopen is kind of the mobile way of checking the pressure.
You can tell my ER is showing, because me and a slit lamp don't get along well. Actually, I was lucky. I trained at a center that was part of the Eye Institute in Chicago. So we saw a ton of ophthalmology cases, probably a lot more than most ER programs would.
Great.
It was great. And the poor residents were on call all the time. So we could kind of just call them in and go in and learn. So I did get to see some cool stuff.
That's great. That's great. It is very niche, though. It is very, very specific to our field. So.
Oh, it totally is. Okay, another this or that, acid or base in the eye?
Oh, I would probably go for acid for hopefully just get it right out.
Right. Hopefully neither is always the answer, but yes. It's funny. That's a board question in the ER world all of the time. I don't know why, every specialty's got these weird questions they like to circulate on the boards, and invariably you'll get something asking like which is a worse outcome, acid or base in the eye, or that type of thing.
It's funny because we don't actually see that often, because I think those patients come to you guys.
Right.
So I vaguely remember from medical school those kind of buzzword questions, but we actually don't see that a ton.
Sure, which is probably a good thing.
Yes.
I distinctly remember I had an overnight, frantically calling the ophthalmologist. This was back in residency, but someone worked in a motor shop or something, and it got some horrible acid in their eye. Yeah. And, you do your fluorescein stain, and the whole thing lights up. It just looks awful. And so, and Jordan, for reference, by the way, fluorescein is like a dye that you put in someone's eye. You can take a look around. And these are all things, we don't like to call the specialists, and especially ophthalmologists have a great life. We can talk about that, but they're not, typically up at 2-3 in the morning. So I'm calling and I'm like, I'm really sorry. Everything in the eye looks bad to me, but this looks really bad. What should I do? And it's funny. And why I'm bringing this up is I think the answer oftentimes is I'll see them in the morning, which we feel is it's not a sense of urgency, but maybe you can talk to kind of the timeline of how there really is more time than it feels in the moment.
Yeah. So, I think there's certain things that are obviously acutely distressing and worrisome, but there's actually not much to be done. And I think those are the things that you guys probably see more of. So, yeah. For example, a painless loss of vision kind of like, a buzzword. It's like every optometrist fear is painless loss of vision. But the sad reality is a lot of times there's not a lot that can be done for painless loss of vision. So even though it is, catastrophic, I mean, would you call that an emergency? Because there's not, any intervention that can be done.
Right.
Whereas painful losses of vision, like, your angle closure glaucomas, for example, that is, something that, really can be treated and is really time sensitive.
Yeah. Jordan, I'm curious from a non-medical perspective, and then Dr. Vadada, we will leave your medical brain alone for a moment. But
she didn't know what she was getting into coming on this podcast. She's like, I did not sign up for all this.
And you can always sidestep. Like I said, we don't hold you to any. We always say nothing is medical advice; it's conversational. But Jordan, what's something that you think of? A lot of people go, "Oh, eyes freak me out." Like, where are you on the spectrum here?
Well, can I derail very quickly and tell a funny story from college? Dr. Vadada will appreciate this. I was cutting an habanero pepper, super spicy, wiped my eye, vision gone, burning.
Oh, wow.
My face, I put it in a bowl of milk because Dr. Google told me to do that. So it is funny when you guys are talking about like what is urgent to go to the ER versus to come see you, because that felt life altering for me. I'm sorry, Adam. I had to go there. What did you even ask me again?
That's a terrifying story. I was more just asking, what are the things that you think of when you think of eyes, eye health, or things that worry you about the eyes?
Well, so from a patient perspective, Dr. Vadada, I don't wear glasses, don't wear contacts. I think I have healthy eyes, but I have never been to an eye doctor. I'm 27 years old. Is that something that should be in my regular scheduled programming for checkups?
So they say, unless there's an urgent matter, they say, after 40 is okay to have an eye exam. So yeah, I mean, I think they say like once in your 20s, twice in your 30s, and then in your 40s more regularly. So so you still have time, but yeah, I mean, obviously, unless something is wrong, see your eye doctor sooner. But if you're okay, then I would say once in your 20s is fine.
Yeah, we were talking offline earlier, and we don't have to get into the specifics, but I have floaters in one of my eyes that started in residency. And I remember, like every, medical student or resident, you're like, oh my God, I'm having a detachment, like go to the worst scenario in the book, which Jordan, basically speaking, is like the back of your eye kind of falls off, the part that lets you see. So no of course, yeah. Well, it's like, it can be, correct me if I'm wrong, Dr. Vadada, but it can be fixable depending on the type, right? There's potentially a way to laser it back.
So floaters.
Detachment, a full detachment.
Detachment, yes. No, a detachment can be fixable. Yes, you can laser basically the area that's elevated. You can kind of laser it, and when you're lasering it, it's like exactly like you said, tacking it down, and that's essentially fixing the issue.
Right. And that was kind of my understanding. And so when this is happening, I'm thinking like, oh my God, someone needs to do an eye exam, because if there ever was a time to put it back, like I'd like not to lose and that could be permanent, Jordan, for reference. Yeah. So I went and looked, and I actually had this admittedly awful thing called a depressed scleral exam. Had never known about that either. And that was an experience, but my retina's there, by the way. So it turns out that we were talking earlier, I have this, just floaters in the one eye. And, I look up at the sky, I see floaters on one side, and it just is what it is. And it's funny, we were talking about things that you just kind of watch them. There's nothing to do. That was kind of the feedback at the time, was like, there's not really anything to do with this. Just, live with it, keep an eye on it. We'll see you whenever we'll see you. So it's, I guess it's just one of those interesting things, but I also would not have been to an ophthalmologist had it not been for that.
Yeah, I mean, I think floaters is common, but it can indicate more of an urgent issue. Right. So I think a lot of people are kind of in that boat. They see, floaters and are worried. I think, floaters, absolutely, if you have like a new onset or like any increase or change in frequency, classically, we describe it as like a shower of black dots. Yeah. So a couple floaters, okay, but if you're having like hundreds of black dots, or something like a curtain coming over and like covering your vision, those are kind of like the classic descriptions of something more urgent.
Jordan rapidly taking notes for
I know, I'm like, whoa. So
you go ahead, Jordan.
While we're on this topic of eye health, I mean, obviously we're in this very digital age, the screen time, I know that puts a strain on your eyes. I have little kiddos in my life. I see them with their iPads. They're this close to their face. That cannot be good for them. Is there any tips or tricks there? I mean, especially even us who we have our desk jobs, we're staring at our computer all day.
Yeah, I think that's such a great question. So for adults, definitely, staring at screens can cause eye strain. So we have this rule called the 20-20-20 rule. So every 20 minutes, look 20 feet in the distance for 20 seconds. And that
every 20 minutes?
Every 20 minutes, yeah.
Wow.
I need to set a timer.
That kind of, relaxes your eye muscles and decreases your eye strain. Lots of lubricants to the eyes, because when you're staring at a screen, you tend not to blink as much. Lots of lubricants, lots of breaks. You can keep like a humidifier by your desk as well.
Oh.
Because it absolutely, digital strain is absolutely, is real. And I can say that personally too, as I'm doing charts,
right.
I try to kind of go by that 20-20-20 rule also. For kids, it's, there's always a worry, like, is it going to damage the eye? The studies have kind of been mixed. There are some studies showing that, too much excessive near work has been linked to myopia. Some studies have shown it's kind of not so strong of a link. The one thing that we do know, though, for kids specifically is outdoor time is key to preventing myopia. So you should try to do 2 hours of outdoor time. And that has been shown to prevent the progression of nearsightedness in kids. And we don't really know why. There's some theories, maybe outdoors, you're not, seeing things up this way, or you're looking at trees in the sky, or there may be something about actual, sunlight too, the effect of sunlight on the eye, which may be a part of it, but no one really knows why. But we just know that outdoor sun for 2 hours has been protective against nearsightedness in children.
Very interesting. And I'm assuming the 20-20-20 is to make it easy to remember. Is it like you could look out the window 2 miles away, or is it specifically you want to be in that kind of like midfield distance?
No, it could be any distance. Yes.
Gotcha.
It doesn't have to be like exactly 20 feet. It could just be any distance. Yeah.
What about this fad of blue light blocking?
I was just about to ask that.
I figured that was coming.
Are the glasses a scam, Dr. Vadada? Let us know.
Yeah, so blue light blocking glasses have not been shown to prevent any eye strain or eye health issues. I think it kind of emerged during like the COVID time when everyone was kind of on screens, but there has not been any clinical studies showing the effect of blue light glasses on eye strain. Now, there have been some, again, not definitive studies, but some evidence that maybe, blue light is not so great for sleeping, especially at night. You can, try to avoid blue light. Again, the studies aren't so definitive, but, I will say it's not going to hurt you. So there's worse fads out there than wearing blue blocking glasses, but most likely it's a placebo when it comes to eye strain and eye health. Very
interesting. I have one. This is, I didn't realize we get so far down the consumer rabbit hole, but I think it's really interesting. Are you familiar with the Apple Vision Pro that came out last year? Have you heard of that?
I've heard of it, yes.
What is that? I'm not familiar with that.
Yeah, so to describe it, it's a headset, like a VR headset, but it has very high resolution screens inside. And I ordered one early for some testing for some other projects, and I wanted to see, kind of what the hype was about. I'm not even sure that Apple still makes it anymore. It was kind of like an early prototype type product. But my question here is, it turns out that they're just 2 tiny, basically eye-sized screens that sit, less than an inch, probably centimeters from your actual eye. And I don't know that we've ever had or used tech that way before with our eyes. And what's crazy is when you put it on, it has, it has external cameras. It does obviously depth of field. And so it feels it's augmented reality, virtual reality. So you can, there was like a little button you could actually dial the outside world out. So you were totally in a virtual place, or you could kind of bring it back in and it would come back in and you could see your hand in front of your face. So my question is, do you think that we need to look into, or there's room to look into, I guess, screens that close to the eye and how the brain perceives and processes and how the eye works with that? Is there literature on that already?
So, there's, I guess, slightly different. There's the Oculus, right?
Right.
And so I think the main issue with that so far is the eye strain.
Mm-hmm.
Again, it's just, focusing at near and then just not having that same like relative vision. So
Right.
like, I guess you could kind of liken it to being motion sick, right?
Yeah.
So it's like it's about your, what you're focusing on. And so when you're wearing these like headsets and you're kind of really focusing on this one image, your eyes can be strained, right? You're like overusing your eye muscles and that causes eye strain. There haven't been any studies showing that like excessive near work for adults, has caused any eye issues. Like, too much reading or reading in dim light is not going to make you more dependent on reading glasses or decrease your vision. I think it just comes down to the eye strain issue.
Yeah. It makes sense. It's really interesting. I'd love to see like a cutaway of the eye and how it's actually accommodating, because it is so close, and you do like within the vision, you feel like you're looking out at the wall 20 feet away, but also in at something that you're holding right in front of. But the reality is, like, is the eye actually accommodating, or is the vision within the system just, changing focus?
That's interesting. Yeah, it's interesting.
Yeah, it's early stuff, but it'll be interesting to see.
Yeah, sure.
I want to change gears a little bit. Obviously, this is a social media based discussion. You're on social media. You've been quite active. What brought you there? Why? What's the value for you?
Yeah, so that's a great question. So I'm actually pretty new to social media. I started, not a year ago even. Call it midlife crisis or call it, just kind of realizing that time is not forever and time is short. And so it's something that I always wanted to do. I became a spokesperson for the American Academy of Ophthalmology. And so that kind of, stimulated it, I guess. I kind of stirred it on. But I think, I've always kind of had a passion for teaching. And so this was kind of a great, venue to do that. Yeah, social media has always kind of been something that I wanted to pursue. And it's been fun. It's nice to have a different, different parts of your brain working. So, for so long I've been a doctor. So I've had my doctor brain, and it's nice to kind of explore different avenues, the creativity behind it, and just, even like learning something new and how something works, and kind of facing a new challenge has been great, actually.
Yeah, I found for me, it scratches another side of the brain. Like we do this one thing clinically. We've studied for years. It's all on like the one side, if you go by the sides theory there. And then it's like reaching across is really that corpus callosum of like medical knowledge to creativity and expression. What we call knowledge translation here, which is, taking those tricky medical topics, but making them accessible, whether it's for peers or patients. So I think it's really interesting you're tapping into that. Yeah.
It's funny. Someone once described it as when you first start, it's like climbing Cringe Mountain because everyone's like, oh, what is she doing? And like, really putting herself out there. But now I feel like, I think the hardest post for me was the first one.
Right.
And because, once you kind of get yourself out there, it kind of becomes easier, it's like, okay, well, the world's still moving, and,
totally.
You think that you're taking up so much of people's headspace, but in reality, it's not really like that. And, you kind of put yourself out there in the world, yes, but, people adapt to it. And, it's kind of like holding your space. And it's kind of a nice feeling, and I do think that it goes hand in hand with like a midlife, call it crisis, but maybe a midlife realization that time is short. And, there are things in life that I want to do, and, I don't want to regret not doing. And so I definitely think that social media is one of those things.
What do you think for patients and for peers, maybe? What's the value? Like, if you were talking to a colleague, should they get on social media and why? And then why do you think that patients follow you?
Yeah, I mean, I would definitely recommend social media. I think it's definitely, can open up doors that I never knew, like even just networking. It's been so great meeting, other doctors like, yourself
Sure.
and other people in the field. And it's a really nice way to kind of get your voice out there.
Absolutely.
I think that, people really respond to fun, like, ways of putting yourself out there too. So I think that if you're going to do a trend, especially as a doctor, I think it's a nice way to kind of, be engaging with people, but also, let them leave with a tidbit, let them leave with like a new, piece of knowledge that they may not have had. And I think in some small way, it is kind of, shaping the world out there and doing your part to kind of educate.
I was
Agreed.
going to ask you, Dr. Vadada, is that what you kind of feel like is your secret sauce? Because, I mean, for only being on social media for a year, you've grown a huge online community.
Oh, thank you. Yeah, I guess so. I mean, to be honest, to be perfectly honest, I feel like I'm still kind of figuring it out. Like some days I'm funny, some days I'm serious, some days I'm like a champion of women's rights.
Yes.
I feel like every day it's kind of different. And so I am still figuring it out with like, the trends or, should I be more serious? And so, but I think like it definitely is a reflection of myself. I think I am embody like all of those things. I like, sometimes I'm serious, sometimes I'm
Sure.
funny, sometimes I'm, really like, type A, got to get this done. And so I think like, I do think even though my reels are kind of like, they do run like a large spectrum, but that is kind of who I am. And I think, from what I hear and from what I know, just kind of being authentically yourself is so important. And so that is what I'm trying to do, I guess.
Do you know, on the topic of social, do you know Will Flannery?
I know the name, yes.
Okay. Yeah, so I think he really has the comedy side nailed down. So you got some tough competition there, but there's definitely, at least from my seat and from being in social media a while, there's such a gap in education. I mean, we had so many, just today, so many interesting questions organically for you around eye health, because it is such a misunderstood, like you said, it's such a subset of medicine that's really like so far beyond medical school. You really don't cover most of this. And so I think a lot, both peers, right, colleagues, and also patients have a ton of questions about ophthalmology. So it's, really commend you for getting on and
thank you.
sharing content.
Yeah, I mean, it's nice because, I think like of the specialties out there, a lot of them are more kind of, common terms like,
Sure.
You've got your plastic surgery, your dermatology, but I think kind of to your point, I think ophthalmology hasn't really had like a social media moment.
Right.
So I'd love to see that happen.
Maybe, what is it, Jordan? Get me if I'm wrong, but is it the It Girl for this year?
Dr. Vadada, you are the it girl.
No,
leading the way
very
for ophthalmology as a whole. So
Yes.
Jordan checks me on my trends, so we're good. Dr. Vadada, I'd love to get into, as kind of a last step here, you have some business interests as well, which I always find interesting as an entrepreneurial physician. Share with us, what are you working on? What excites you about that?
Sure. So, a passion project of mine, which started as, kind of like a passion, was this idea to create a prostaglandin-free eyelash serum. So I don't know if you're familiar with like the eyelash serum space, but a lot of eyelash serums use actually something called a prostaglandin analog, which originated as a glaucoma medication. Mm-hmm. And so basically we would see these glaucoma patients come in with these like long, like Minnie Mouse eyelashes, like so fluttering. And so a lot of eyelash serums use these prostaglandin analogs in their formula. The problem is it also has a lot of side effects. So sunken in eyes or loss of fat around the eyes, dark circles around the eyes, redness, irritation, burning, drooping eyelids. So obviously, side effects that are not ideal when you're using a cosmetic.
Right.
And so after seeing, a lot of these side effects, I wanted to create a prostaglandin-free eyelash serum. And so it started out, I kind of first just started moving the needle like a little bit. I was like, okay, well, let me, do some research and see, if there could be a prostaglandin-free formula that would work. And then let me find a lab, and then let me design the artwork, and it just kept kind of going. And then I was in it so deep that it was kind of at one point like, okay, well, I'm going for it. And so, so I've created an eyelash serum that has a patented new ingredient. The new ingredient is called chitosan 2 biotin. And so, not to get into like the nitty gritty, but chitosan is the only naturally occurring positively charged polymer on Earth. And it's this form of chitosan is derived from a mushroom. And because the eyelashes are negatively charged with keratin, the chitosan is attracted to the positively charged chitosan is attracted to the negatively charged eyelashes. And for every polymer of chitosan delivered, there's 2 molecules of biotin delivered as well. And so, anyways, not to get into the details, but basically, so again, I got the patent for it, and then, it kept kind of snowballing. And so, so now I have created this eyelash serum. It's called Keralogic ND. And it's very exciting because, the science is definitely there. And I knew that as an ophthalmologist, that there, was a natural, healthy way to, enhance the appearance of your eyelashes. And so what started out as an idea is now reality. And
it's amazing.
Thank you. I think it also, again, has very much to do with this just kind of awakening in me that, time is short and life is short. And, what do they say? The only certainties are death and taxes, right? So it's just something that I always wanted to do. And I'm doing it.
Dr. Vadada, we need to chat offline because I'm using an eyelash serum that I need to hear your opinion on, but I think I need to order yours. I'm curious though, with this process, with your obviously credentials and your commitment to sourcing these quality ingredients for it, did it make the process harder in finding people to work with where that same vision aligned for all parties?
Yeah, I definitely think that there's like a white space in the eyelash serum market for something like this because, there has been a backlash with the prostaglandin. So I think that a lot of people were open to it. And it's interesting to see the different worlds. Like there's definitely a biochemistry world to cosmetics that I was surprised about and not expecting. And so it was actually really nice and felt very familiar and, very soothing to me almost. I was a biology major. I loved organic chemistry. So it was nice to kind of go down that avenue and work with like a biotech lab to create this new patented ingredient. And so, I was surprised at how open people were actually and kind of, taking this idea and making it into reality.
That's I have a million questions and not the typical focus of this podcast, but would love to talk offline because really cool that you've done that, of course, all while clinical practicing. Practicing clinically, I suppose, sounds better. Before we wrap, I know we're getting tight on time. We always like to offer anything that you'd like to call out for the listeners, for them to check out. I'm sure I'm going to Google what eyelash serum does outside of the eyelashes. Maybe it sounds like maybe I don't, but maybe my fiance needs some. So I'll send it to her. But anything that the listeners should know?
I think some great, topics include the importance of just kind of eyelash health and eye health, especially when it comes to makeup. So I think that, really at its base, I think, a healthy appearing eye, the most important thing is to kind of, care for your eyes. And so that means taking off your makeup at night, not sleeping in your contact lenses, kind of following certain hygiene, advice, such as, not tight lightening your eyeliner. And I think that there definitely are certain eye makeup brands that are more open to, or I guess are more eye friendly and eye health friendly. And I think it's really important. I think a really important take home message is whatever, cosmetic or eye care, skincare products you're going to use, it's always so important to look at the ingredients, because a lot of times, if the FDA isn't involved, a cosmetic company can kind of put whatever they want into their formulation. So really important to just kind of do your own research and be your own advocate when it comes to cosmetics.
Are there any specific ingredients just off the top of your head that we could be looking for?
Sure. So you want to
asking for a friend.
You want to stay away from parabens. You want to stay away from preservatives like BAKs. Fragrances, a lot of times can cause issues as well.
Okay. I'm just going to go clean through my makeup really quick, guys.
Yes.
Dr. Vadada, this has been great. We really appreciate you joining us on the podcast. Thank you so much for your time and expertise. Everyone, you can find Dr. Vadada at Ami Vadada MD on social media. Please give her a follow, and thank you again for joining us.
Thank you.